Hello, welcome to the CIRS Healing Collective expert guest video series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a shoemaker proficiency partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you. So you all have come to hear Dr. Mary Ackerley. She really needs no introduction, but I'm going to give her an introduction, and I'm going to share with her a little bit about our group as well. I'll start with our group because that's a little bit simpler. Dr. Ackerley, we are the CIRS Healing Collective, and there are about 300 of us here from around the world who identify as having CIRS, or maybe a family member has CIRS, another form of biotoxin illness, Lyme, other environmental illnesses often thrown in there. And we span all of kind of the gamut of maybe been sick for a year or so, all the way up to several years. And as I mentioned before, it's a savvy group. And a lot of people already know who you are. Most people here are following the Shoemaker protocol in some version, but also very open to additions, modifications, hacks for things that, we're just, when we're running up against a wall, what have you learned? So we're really excited to learn from you because you've been doing this for a long time. So welcome. Before we start with the interview, you guys, I'm going to read Dr. Ackerley's bio so you can appreciate that this is such a treat that she's here with us. Dr. Mary Ackerley is a classically trained board-certified psychiatrist and integrative physician. She graduated summa cum laude from Harvard University, studied at the National Institute for Mental Health, and finished her residency in psychiatry at Johns Hopkins. How about that for an educational background? Dr. Ackerley began to treat patients with biotoxin illness in 2010, being certified to treat CIRS, chronic inflammatory response syndrome, in 2013. She's been doing this for a while. She is the co-founder of ICI, the International Society for Environmentally Acquired Illnesses. I'm also a member of that association. Providers from around the world collaborate to bring research and integrative medical care to individuals suffering from a variety of environmental illnesses. As an integrative holistic physician, Dr. Ackerley specializes in natural treatments. Her patients commonly see her for anxiety, depression, brain fog, and chronic fatigue, and her skills include the ability to manage cognitive and psychiatric symptoms often found in complex chronic illnesses. So we can all relate to all of that, right? Complex chronic illness and the mental health and the cognitive sequelae, the aspects of our illness that are related to neuroinflammation, but then are also practical. I'm going to go ahead and let in a few more people. This is her area of specialization. I don't know that we have another classically trained psychiatrist in this arena of environmental illness, of biotoxin illness. And so Dr. Ackerley brings something really unique to the table as a classically trained psychiatrist and neurologist. She's looked at hundreds probably of neuroquants. She knows what mold looks like on the brain. She knows what neuroinflammation means for our mood and for our cognitive status. And she's got a lot of really cool tricks up her sleeve. So you guys know one of the things that we're going to be talking about is oxytocin. She was sharing with me in our little prelude, our little pre-chat, that there's some other things that she's excited to share too, that she's seeing a lot of benefit with in her client population. So Dr. Ackerley, thank you so much for joining the CIRS Healing Collective, and welcome.
Hi, it's very nice to see everybody. It is a little sad to know that so many years later, this many people still have mold, and that it would have been nice to think that this had been eradicated, the environmental issues had been taken care of. And no one was caught unaware of mold, which is what happens to everybody. You don't think about mold until you get sick and somebody finally says, do you think you might have mold in your house? So there's a little sadness, maybe that there
Yeah.
are this many people, but it's also nice to know that treatment these days is much faster, much
Yeah.
quicker than it used to
Yeah.
be.
Yeah. I so agree, Dr. Ackerley. As an integrative psychiatrist, tell us, Dr. Ackerley, how you originally learned about mold exposure as a contributing factor to mood and cognitive impairments in your patient population.
So I think I've told this story a lot of times if you've ever heard me talk, but essentially, we had a great mold doctor in Sierra, in Benson, Arizona, Dr. Gray, who's not given enough credit. He's been doing this a very long time too. I think maybe even longer than Richie Shoemaker. And he was somebody I actually learned from. But he's not a psychiatrist, and people would see him for mold. And because I was an integrative psychiatrist, they figured I was friendly. And they would come to see me, and I thought, like any good, well-trained psychiatrist, it was all psychosomatic. Right? There's no such thing as mold because it's not in DSM, whatever. And so I just, but I'm a nice person, okay, in the sense that I didn't humiliate people for having this. And at one point, I began to get interested in the labs and see these things seem to be real. So I was treating his patients for more psychiatric depression and anxiety, which is really common in the mold population because of it inflames the brain, and these are very common symptoms of an inflamed brain. So eventually I did have one patient who was seeing me who wasn't an identified mold patient yet. And she'd been coming to my office for, I think, anxiety for a year or so. And she became totally lost. She called from like 2 miles away from the office saying, I don't know how to get there. Where are you? She's half an hour late. And it's like, what do you mean, Dee? It's like, you've been coming here for a year. And she said, I'm totally lost. I don't know where I am. So we had to actually give her directions to get her there. And when she got her, I said, I thought I'm going to have to call her sons and tell her she's become demented, because this is a common dementia symptom, to be honest,
Right.
lost in familiar places. And she was in her 70s. And then I started to ask her, what's going on? And said, well, I'm living in a home, and they're remediating, they're not remediating, they're renovating it. And in my bedroom, we have like a Akatia ceiling, which in Tucson is very popular. And they sort of pulled that off, and it's like all this black mold, and I'm just there. And they said, everyone said that's okay. And I said, my God, I think you might have mold symptoms. And we went through actually Shoemaker's book, and she had the ice pick headaches, and she had diarrhea that was out of nowhere, and she was incredibly fatigued, but it was that lost in familiar places that really was an issue. So I put her on cholestyramine. It was my first patient, and I treated her for years until unfortunately she did develop Lewy body, and I think she's dead now, but that was like in 2010. So her success, she got very well from just small amount. I mean, it was a great first patient to have because small amounts of cholestyramine and getting her out of the home just worked. And that hasn't happened in a long time for me. That simple combination worked. So it was really good first patient. And as the word got out that I was familiar with this, plus a lot of my psych people who were seeing me for depression and anxiety, I'd asked the question, like, do you think you might have mold? And like one of my longest term patients, they own a big company in Tucson, and most people here in Tucson know who they are because they founded the mold group in Tucson. I remember asking her, do you think you might have mold? It's like, no, no, no. And then she got someone to look, and they had mold. It's an older Tucson home, and tons of mold. And that has been a patient, definitely got her and her husband better. But some of that brain on fire is based on those two who had every issue, marital issue, financial issue, brain anxiety issue possible. And I've learned tremendous amount. And they're both still alive and doing well, and I still see them. And in fact, she wrote a very nice note lately about, something else I'd done for her. So I do see people for a long time, and it's not always we get people better from mold, but they're still vulnerable.
What does brain inflammation look like on a neuroquant? I know that this is something that you look at a lot and kind of specialize in. Are there certain areas, certain like fingerprints of a neuroquant where you can say, yep, that looks like mold?
Yeah, I've seen actually probably close to 1,000 or more than 1,000 since I've been doing it. And there's a pretty clear pattern of, what I call sea of blue, lots of blue on the old neuroquants, where they would just label things blue if they're 95 percentile or greater. And it's usually going to be in the limbic system, the thalamus, the hippocampus, the cerebellum are major areas. Frontal lobes are really common. And that inflammation is just very easy to see. You're just looking at the whole brain size, 99th percentile, for your age and sex, you have an inflamed brain.
Right. And when I first saw NeuroQuant report, I thought that 99% meant that like I got an A, like I'm better than most people, but this is where you don't want to be in the 99. You want to be more in the midline, around 50%.
Right.
You want to be in the middle. You don't want your brain size to be bigger than it should be or smaller. You want to be right in the middle, right? We don't want that 99%. That doesn't mean we get an A+.
It doesn't equate with intelligence. I do get asked that a lot. It doesn't mean I'm more intelligent now. And we want to see it come down. It means your brain is not functioning properly when it's that inflamed.
Right. So you see more atrophy or more inflammation, more hypertrophy than atrophy, or do you see certain regions that are classically atrophied as well?
I think that's harder. The cingulate, which also has a lot to do with post-traumatic stress disorder, can often be atrophied. The caudate can go either way. It can be highly inflamed or sometimes atrophied. And again, things have gotten really mixed up. Things would have been much clearer in 2019. COVID and the vaccine clearly changed the brain. Repeated bouts of COVID clearly changed the brain. That's being documented. And in these patterns, because I do follow it a lot, we see both inflammation, the cerebellum, and atrophy. And the thalamus may be atrophied, the hippocampus and the amygdala, which again is usually inflamed in mold in a lot of people. So it's a very confusing to just say there's a fingerprint, given that most of the population now has a new disease that's new to us in the last 5 years.
You have looked at so many neuroquants. Is there anything that would alarm you, like this isn't mold or even COVID? What would something really strange or unrelated to exposure look like on a neuroquant?
Where everything is in the 50th percentile or below, and we're seeing multiple regions of atrophy. That's almost always Lyme, co-infections, maybe COVID. It's not just mold or mast cells, and mast cells looks like mold. Mast cells are in the amygdala, they're in the thalamus, they're in the cerebellum. And I think a lot of the swelling we see is mast cell inflammation. So that's pretty easy to see. But when I see, less than 50% in most of the regions and smaller than 20% like white matter and stuff, I am more worried about it. Or what we call patchy asymmetry, where these differences in size are like greater than 20%. In multiple regions, that's often a sign of infection or traumatic brain injury too. So, and I see people recover from that, but I'm almost always suspicious that I'm looking at more than mold when I don't see swelling.